How can we help the mothers to identify these syndromes? So the first thing is that we can go ahead with the NTSCAN, or the sonography that is done at 11 weeks to 13 weeks 6 days period, in which we measure the nuchal translucency thickness, the presence or absence of nasal bone, then the ductus venosus and the tricuspid spectral waveforms, and we can find out the subset of the children or the feti or the fetuses who are going to have the probability of developing Down syndrome. Along with this, we can also have the titers done from the mother's blood, called as biochemical markers. There are few chemicals that are secreted in the body of the mother, and they are analyzed to find out the probability of having Down syndrome. When we combine this ultrasound findings and the biochemical marker test together, the chances of detecting the Down syndrome rises from goes up to 93 to 95%. But yes, the NTSCAN should be done by FMF certified person with those criteria at least, and even the lab investigation should be done from the standardized lab where the moms are calibrated frequently. So this is how we can identify the high risk or the low risk population. Now let us understand that Indian government has not yet started doing screening for all the pregnant women in India, and this facility of screening Down syndrome is only available in private sectors, and that too not every private sector is doing this. So after screening the patient, if the patient comes out to be high risk, then we have to go ahead with diagnostic test, and these diagnostic tests are performed after the procedure of Chorionic Villus Sampling and the Amniocentesis, which are invasive procedures wherein we try to get few cell DNAs from the fetus, and then we do some genetic testing on it to identify whether the fetus is really carrying Down syndrome or not. So once the cells come out positive, the cell DNA comes out positive for T21 or Trisomy 21 or Down syndrome, then we can go ahead with termination of pregnancy, and we can help the mother not to deliver a mentally disabled child. So let us understand the awareness of the screening test and diagnostic test is very important, because a screening test coming high risk doesn't equate to the fetus having Down syndrome. So a diagnostic test after high risk biochemical or a combined screening test is very much essential to decide the course of pregnancy. Now there is another test called as Non-Invasive Prenatal Testing screening test or test. This test, also called as NIPT or NIPS, it helps identify the Down syndrome up to the detection rate of 99%. Again, it is done on the maternal blood, and the few floating pieces of the DNA of the fetus are there in the mother's blood, which can be used, which can give us the idea whether the mother is carrying a Down syndrome baby or not. Again, this is though a good screening test, but it is not a diagnostic test, and if we have high risk in the NIPT, it is mandatory to go for diagnostic test to know whether the fetus is really having Down syndrome or not. Now why many of us must be having the question why doesn't we do the ultrasound scan of the mother, then why can't we identify the Down syndrome? But let me tell you here that only 30 to 50% of the Down syndrome babies will show some or the other soft markers, and rest of the fetus will not show any marker, and we cannot identify the Down syndrome.